Hi everyone, it's Margaret, and I'm coming to you today raw and real and going to get very personal about my personal story. March is Endometriosis Awareness Month, and my endometriosis story started over 40 years ago. And quite honestly, it's a devastating health ordeal that I've walked through, but it has also been the foundation and really the launch pad for a passionate and fulfilling career in preventative and integrative health. So many of you know about my story, but I haven't shared quite like this before, and I just feel compelled and pulled to do so because now, finally, 40 years later, this disease is getting some attention, some long overdue attention that, quite frankly, women have not been given for a very, very long time. So my story started as a young girl and as a competitive athlete, a hopeful young teenager, and really excited about life. But the moment I started my menstrual cycles, it was not good. And although I didn't look sick, and because I have a kind of a type A personality that pushes through things, I really just tried to push through excruciating pain. And I have to preface everything by saying I had the most incredible, supportive family. My parents were my biggest cheerleaders and advocates when I couldn't advocate for myself. But when your own family is being told from doctor to surgeon to specialist that there's nothing wrong with your daughter, and quite frankly, I was being labeled as a hypersensitive only child, a drug-seeking teen, and a competitive athlete with a nervous stomach, I knew even at the age of 14 that there was something wrong. There was something seriously wrong. And unfortunately, it took over a decade to finally get a diagnosis. And here's the really crazy thing about that, is that despite, and I know I'm not alone because the stats that I'm going to share in the blog that I've written about today in Canada, the number of women that suffer with endometriosis, that the average woman, it often takes over a decade to get a diagnosis, and sometimes double that. When I look back, I can really feel so many emotions. And for a very long time, I wouldn't speak and say the word endometriosis because it came with so much negativity. It came with so many experiences that literally hijacked my life. This chronic disease that I was told was in my head, that I was hypersensitive, that it was normal period pain, caused 4 bowel obstructions where I required nasal gastric tubes for it to be treated. It caused a lung collapse because I had endometrial-like tissue on my lung. I have lost count of the number of hospitalizations, and not just in emergency, but for days on end, trying to seek relief and answers from the suffering that I was experiencing. I was often had a distended tummy that made me look like I was 6 months pregnant. And my bowel function was greatly impacted. I was nauseous and sometimes vomiting. And the pain, it was literally debilitating. But despite all of these symptoms and the presentation that I was given, I didn't look on the outside like I was sick. And therefore, many of those countless visits to hospitals and admissions to hospitals left me feeling humiliated, demoralized, and quite frankly, my efforts were fruitless because it wasn't coming up with anything. I was being told that I need to figure out how to cope with my period pain. That was, as a young girl. I am 56 years of age now, and it's taken 40 years for attention to be given to this chronic, debilitating disease that affects millions of Canadians. Now, I have to tell you, the 10 surgeries that I had and how I was finally diagnosed really was the beginning of my career as an advocate for everyday people, to have a voice, to be the CEO of their health, because I was sick and tired of being sick and tired. I was sick of having my life hijacked. I was embarrassed because I missed so many things. I wasn't like the typical teenager and university student because I couldn't live carefree, because I didn't know when this horrible disease was going to hit me, where I'd be crippled over in pain and literally couldn't function. And living with chronic pain impacts every aspect of our health: mentally, physically, emotionally, spiritually, financially, sexually. It impacts your relationships. It impacted my family greatly as they watched me suffer and they were asking for help, but there were no answers. I started to question what was wrong with me. Why wasn't I strong enough to push through this? Why wasn't I big enough to push through like every other woman? But I kept thinking to myself, everyone can't feel like this. This is crazy. And so it impacted my education, and the stats bear out in Canada how education is impacted. I had to leave third year university to go to Toronto to have surgeries when I finally got my diagnosis for endometriosis. Because when I was at the University of Waterloo, I refused to leave an emergency room until I got answers, despite the fact that the doctor really wanted to discharge me and say, "You look fine." Ultrasounds and transvaginal ultrasounds and all kinds of investigations, blood work, to no avail. Yes, I had some ovarian cysts, they would say, but you need to cope better. Until that third year in university, when I had ended up in hospital yet again. And I got to tell you, your friends even start to lose, I don't want to use the word patience, but it's hard to support someone who's in chronic pain. And it's hard to be the one in chronic pain watching how your life is impacting those that you love. And when you're desperately trying to just be normal and to push through this devastating pain that you're experiencing, because all I wanted to do was be normal and be like every other girl my age, living a carefree life. But because I didn't look sick, people start to question your integrity. They start to question your mental health. Maybe you need some counseling. And I probably did need counseling, because when you have chronic pain, it impacts your mental health. And when you have bowel obstructions, it impacts your gut absorption, which leads to mental health issues. None of that was my fault, but I certainly felt like it was. And that third year of university, when I finally looked that doctor in the face and said, "I'm not leaving here until you find out what's wrong with me. Something is seriously wrong." And he said kind of flippantly, "Well, you could have this disease called endometriosis, but, you look too healthy, too young, and that's doubtful." And I said, "Well, what is endometriosis and how do we find that out?" And he said, "Well, we'd have to do a diagnostic laparoscopic surgery. And I don't know if you really want to go through surgery now, do you?" Almost making me feel guilty for wanting answers. I stood my ground as a young 19-year-old woman. And I said, "Yeah, actually, I do want that surgery. Because if that's how we're going to find out or rule something out, then yes, I want that surgery." And so we did that laparoscopic surgery. And I got to tell you, when I got the diagnosis of endometriosis hours later, when I'm groggy, my parents had gone home because the surgeon said, "Oh, she won't wake up," and really didn't have the decency to talk with my parents, who were worried and scared and had been there for years supporting me. They thought everything was fine. But instead, at 2:00 in the morning, when I'm still groggy from surgery that was done late into the evening, I had a specialist look at me and tell me, "Well, it looks like you do have endometriosis, and very severe, in fact." And you know what his solution was at that time, when I was 19, in university, not married? "Well, you should get yourself pregnant, because that will fix your problem." Now, at the time, I could barely say the word endometriosis, let alone know that infertility is a big contributor to, or that endometriosis contributes to infertility. But to say that to a young girl without really other solutions except pain medication and hormonal treatments that caused me so many side effects. And years later, I now have osteopenia from the hormonal treatment I was given against my will 30 years earlier. I was left feeling, am I relieved to know this? But there was no help. And that meant I had no idea for the next decade that I'd be walking through absolute hell. 10 surgeries, those bowel obstructions, the lung collapse. And the only option that was given to me was just pain medication. And don't get me wrong, I took it because all I wanted to do was be out of pain. Wouldn't you? But there wasn't any other solutions. They weren't offering anything else, any other options. There wasn't any talk about nutrition and anti-inflammatory foods and exercise and other types of treatments that might help me help myself. No, that wasn't offered. But there's a lot of judgment when people are given pain medication that's addictive. And I gotta tell you, there were times that I'm not proud of the state I was in because I followed what the system was giving me because I was desperate to live without pain. And what this horrible, devastating story taught me was that I had to be the advocate. I had to be the CEO of my own health, because if I wasn't going to speak up, and if I wasn't going to have a voice, and if I wasn't going to go searching elsewhere about how to help myself, no one else was coming to save me. And boy, was I right, because 40 years later, there's a rally cry still to this day to have a national strategy to deal with this devastating chronic disease that doesn't have a cure. And the cure wasn't to go and get pregnant as a young girl. I had it on my bowel. The cure wasn't to go and have a hysterectomy. I had it on my bowel, endometrial tissue outside of the uterus, which essentially reacts to hormones and bleeds and causes pain in the peritoneum that's excruciating. I sound raw, like it just happened yesterday, because the scars are deep. But there's a good ending to this story. And it's really not an ending. It was the foundation of my career in preventative and integrative health. Because when I finally stood my ground and I started to look at getting my integrative health team and trying to find ways to help myself, to reduce the inflammation in my body, which helped the endometriosis, to change some of my diet, to really support myself. And I was fortunate enough to finally have a baby. I went through failed infertility, and I'm blessed with 2 children, and so many women with endometriosis aren't. So I feel so grateful. But I felt compelled to come and say to all of you today that it is long overdue to be supporting people struggling with endometriosis, to be looking for other strategies. And there are more now, which I'm going to talk about in a moment. But what I did realize as a young girl, that is what prompted me through. If it wasn't for conventional medicine, I wouldn't be speaking to you right now, because quite frankly, it was a laparoscopic surgery and nasogastric tubes that saved my life and that got me the diagnosis eventually. It took too long, but it did get it for me. But what's equally and as profoundly true, if it wasn't for complementary medicine, the naturopath that I worked with, the massage therapist that I worked with, the nervous system stuff that I did, the counseling that I received, if it wasn't for my own team and me being the most important member of that healthcare team, I wouldn't be here. In fact, I would probably be terribly addicted to pain medications and not functioning like I see so many women like me. And I was close to that because I was desperate for relief. That's what launched Wallace for Wellness 32 years ago, where I really wanted to bring conventional and complementary medicine together under the same roof and to help empower you, everyday people, to be the CEO of their health. And 32 years later, not only have I accomplished that, but I'm on to this new mission to really start to look at helping to change the legacy of healthcare in this country, which is why I started Preventative Health Awareness Month and movement recognized by Health Canada, which is why I have a podcast called FAMcast, Preventative Health Awareness Movement, to help bring change makers to the table. People like someone I'm going to call out right now, Dr. Matthew Leonardi, who I hope to have on my podcast. A gynecologist and surgeon and a sonologist who is doing unbelievable work in endometriosis detection and treatment. Thank you, Dr. Leonardi, because you're going to be the difference. People like you and the ultrasound that you're doing is going to change the lives of so many young Margarets, people like me that hopefully won't have to suffer. This is a hopeful story now, but we have a lot of work to do, which is why Endometriosis Awareness Month is critically important. And for so many years, I wouldn't even talk about it. I would just say that I suffered with chronic disease because people didn't know what it was and quite frankly went, oh, that's period pain. It was humiliating. I am a warrior walking through a very challenging chronic disease. And I am now here to help elevate other warriors with tools and strategies and healthcare professionals who want to help share their knowledge to help stock your toolbox so more women and trans people don't have to suffer. This was not an articulate video, and I didn't think it would be. I've held back a lot of tears. There's a lot of memories. But I feel really grateful. It was a gift, which I didn't realize at an early age, to allow me to have a very, very fulfilling career in preventative and integrative health. And I hope that this video and this blog will touch even just one woman's life to reach out and to get the help that you need so that you can live well at every age and stage of life. Because after all, we all deserve that. Remember, a healthy tomorrow begins with prevention today. What are we doing to stock the toolbox of all of us, instead of just relying on a pill for an ill, wait till it's broken, sick care system? Endometriosis Awareness Month. If you don't know enough about it, go take a look and read the blog. The stats are staggering. Thanks for listening.